Hello everyone, this is Suprava. Welcome back to another session with me. In today's session, we will be discussing about meningitis in children. Well, meningitis can occur at any ages, but it is most common during the infancy period. And if we see the incidence, then 95% of all cases take place between 1 year to 5 years of age. Also, it is more common in males than females. Well, next let us move on to the definition of meningitis. Now, from the term meningitis, you can pretty much understand that what does the term says, right? So here, meningitis is an acute inflammation of the meninges. So basically, meningitis is the inflammation of the membrane which surrounds the brain and spinal cord. Well, this inflammation can be caused either by bacteria or viruses that we will discuss in later slides. So now let us discuss about the transmission. So the first thing is the bacteria can be transmitted from person to person through droplet of respiratory or throat secretions. And then the next thing is if there is close and prolonged contact. So if somebody who is having the infection, if they cough or sneeze and if there is close contact with them, then there is a chance that, the bacteria or the virus might transmit from person to person. And the incubation period ranges from 2 to 10 days. So we understood how it can be transmitted. Now the next thing, let us learn about the route of entry. So if there is skull fracture or if there is trauma to the backbone or if there is fracture of backbone, then there is a chance that the person might get this infection or the virus or bacteria might enter through this route. And then the next thing is medical procedures. So it can enter, these bacteria or the viruses can enter through during any sort of medical procedures also. And then the last one is blood or lymphatic system. So through blood or lymphatic system also this bacteria or viruses can enter the body. Next, let us move on to the etiologies. So here the etiologies can be classified into different types. So the first thing is there can be bacterial infection. So due to any sort of bacterial infections, there might be meningitis. As I told you that this might be caused due to either due to bacteria or viruses, right? So if there is any bacterial infections, that might cause meningitis. Then if there is viral infection or fungal infection, that also might cause certain types of meningitis. Apart from these things, if there is inflammatory disease or trauma to the head or spine, that also might cause meningitis. And there are certain factors which are considered to be the risk factors for meningitis. So if there is systemic infections or if there is viral respiratory tract infections, or in case of tobacco use, if the mother uses tobacco during pregnancy, and if there is impaired immune system or weakened immune system, that is also considered as a risk for meningitis. So those were the risk factors. Now let us move on to the types of meningitis. So the first type is bacterial meningitis. Now this is an extremely serious condition and this is also known as septic meningitis. And the causative agents of bacterial meningitis are Streptococcus pneumonia, Neisseria meningitis and Haemophilus influenza. But in most of the cases, we can see that around 80% of cases, the causative agent will be Streptococcus pneumonia. And then for 15 to 40% of cases, the causative agent is Neisseria meningitis and the Haemophilus influenza is quite rare. The next one is viral meningitis. Now this is also known as aseptic meningitis and this is more common than bacterial meningitis and it is also less serious. Now in this particular type of meningitis, there is less chance of having permanent brain damage or any sort of disability. But in case of bacterial meningitis, there is a high chance that there will be permanent brain damage or disability and death. And for viral meningitis, there is no specific treatment available and most of the patients would heal on their own. But in case of bacterial meningitis, we have a specific treatment and the treatment will be based on their causative organism. So in viral meningitis also we have certain causative agents which are most likely to cause viral meningitis in child, that is enterovirus, adenovirus, arbovirus, measles virus, herpes simplex virus and varicella. So these are some of the causative agents which causes viral meningitis in children. And then there is fungal meningitis. So if we compare with the other two types of meningitis, that is bacterial meningitis and viral meningitis, we can say that fungal meningitis is not that common, it is less common. And this particular type of meningitis is usually seen in people who have impaired immune system. The next one is parasitic meningitis. Now this is not that common, it's not that frequent we can say, but it is a life-threatening condition. And this is usually caused by parasites which are found in contaminated water, food or soil, and mostly we can see this in underdeveloped countries. And the most common causative agents are free-living amoebas. So that is what is parasitic meningitis. And then there is also one more type which is non-infectious meningitis. So rarely meningitis can be caused due to exposure to certain medications. For example, if there is exposure to immunoglobulin and levamisole or metronidazole, and sometimes if there is exposure to mumps and rubella vaccines, and also if there is exposure to NSAIDs. And the next one is tuberculous meningitis. So this is basically a complication of childhood tuberculosis, and it is a common cause of prolonged morbidity, handicap and death. And if we see the incidence, we can see that it is more prone in children below 5 years of age. So these are the types of meningitis. So the rest of the topic would be discussed in a different session. I hope you've got a better insight about the topic till here. Thank you.